Dr. Michaels, tell us about the difference, if there is any, between a lumineer and a veneer for cosmetic dentistry. You know, to me they're all tooth clip-ons, fingernail clip-ons, but because as patients we're confused. You know, that we keep. You know, it looks like we're talking two different animals when I'm not so sure we are. So shed some light on it, please.
Okay, let's talk about restorations on our front teeth to start with. There's this thing that's called a crown. Some people call them caps. It covers the entire tooth with porcelain. The front side, the back side, the left and the right side. The tooth is completely encapsulated nowadays with porcelain. Back in the old days, it would have been gold. Then there's this other thing called a veneer, which is just on the front of the tooth. It's like a fingernail. It's a thin sheet of porcelain that's bonded to the front of a tooth. So you could say that a veneer is essentially half of a crown, the front half of the crown. The difference between a lumineer and a veneer the lumineer is a proprietary product, whereas a veneer is a generic restoration. There are at least a dozen different types of veneers. They come in different types of porcelain material, different shapes, different bonding materials, different lab fabrication systems. And all of these different things are called veneers. And remember, a veneer is a piece of porcelain that goes on the front of your tooth. A lumineer is a type of veneer. It's an excellent product. Their claim is that theirs is thinner, stronger, and more aesthetic. There's some legitimacy to that, but remember, it's a proprietary product, and there are many, many different types of extremely excellent veneers out there.
Okay. Now, what are some of the, I've heard that, like on a lumineer, the proprietary product, you don't need to inject the person because you don't need to grind the tooth down, so they're basically less invasive. At the same token, I've heard that they don't match quite so well. Give us your take on that whole thing.
Well, here, let's ask ourselves a question. Do we need to grind on the tooth or not? If the tooth is too far in front, you're going to need to grind some off in order to get it back to the correct position. These veneers that we place on the front of the tooth have a certain amount of thickness. And if you were to just attach one to the front of the tooth, you could end up making the tooth too thick in the forward dimension. So there are many times when removal of tooth structure is necessary, regardless of which product you use, including the lumineer. And there are other times when it's not necessary to remove any tooth structure. Some people's teeth are tucked back too far, and your objective in placing the veneer is to make them further forward. So it depends on the circumstances. And this is something that the patients need to understand, that in many situations you will need to remove some tooth structure, and they may elect to not proceed for that very reason, or they may elect to consider a different alternative. So it's extremely important that patients be completely informed, understand exactly what's going on, understand the advantages, and know exactly what the procedure is going to be before they proceed. They need to speak to someone, a dentist who they trust, someone who's going to tell them the reality and advise them correctly.
Okay. So again, we're back to the fact that a lumineer or veneer, really, it is the same for all purpose for us laymen's, and that's just about it. Okay.
That's a lumineer is a category, a type of veneer.
I got it. Wonderful. Now, and without going into it, but you did mention, maybe opting for different treatments rather than lumineer and veneer or crown. Did you, without going into it, did you refer to that to orthodontic and or Invisalign treatment to straighten out a few crooked teeth a little bit?
Quite often, the best result can be achieved through orthodontic purposes, like Invisalign, or like standard orthodontics with wires and brackets.
Okay.
Invisalign is an excellent excellent option for individuals, especially adults who don't want to go through springs and wires and rubber bands.
Sure. We'll talk about that more, Dr. Michaels. Thanks a lot, sir, for clearing up Invisalign and Lumineers for us.
Okay, you're welcome.